Good morning, everyone. Thank you so much for joining us today for our Lunch and Learn series. We have created the series to help educate our patients on various topics and to help them on their journey to wellness. Today, we have Nicole McCallister, one of our Ironwood social workers present, and she will be presenting on advanced directives and life care planning. Please help me in welcoming Nicole McCallister. Nicole?
Hello, everyone. Thank you, Sierra, for that wonderful intro. I'm so happy to be here today as one of the two social workers at Ironwood and a part of our supportive care services department to talk to you about advanced directives and life care planning. I'm going to go ahead and get started with the PowerPoint. There's a difference between life care planning and advanced directives. Life care planning is the process of deciding your medical wishes should you become unable to do so. This includes talking to your friends and your family and those involved in your life and those you choose to be involved in that decision-making process. We don't ask or suggest that you do life care planning just because we think that there's a bad outcome coming for you. Accidents can happen at any point in time. I know I personally have mine done just because you never know. They say you can go down the street and get into a car accident. And so having these advanced directives and life care planning done in advance, just make sure that should an emergency arise, people in your family know what your wishes are and they're prepared to make sure your decisions are made regarding medical treatment. Advanced directives are the decisions we make about who will manage our medical affairs in the event of an emergency. They're the actual documents that express your wishes about treatment that you will receive if you can no longer communicate and make decisions on your own. This means you could be in a coma, or you could be in a state where you're not cognitively able to make those decisions. Who should you talk to about your wishes? This is it can be a difficult conversation, but it's also a conversation that's good to have when you're still able to make decisions, when you're still able to ask questions of your family. Make sure that the people you choose to be your healthcare agent want to be in that role. Sometimes people don't want that responsibility, or they're too emotional and they're afraid that they won't make the decision you want at the time when it's needed. So it's important to kind of go over this life care planning process with your family, with your spouse, your children as age appropriate, other family members and friends, or those you're going to have involved. Sometimes that people invite their doctors or their priest or pastor into the conversation to kind of help mediate things, or just to help support you as you express what your wishes and desires are. The most important person for you to have involved is your healthcare agent. This is the person you select that's going to make the decisions for you once you are no longer able to do so. In Arizona, there's a legal hierarchy or order in which doctors will select somebody should you not have advanced directives in place. It always starts off with a legal spouse. That means a person you're legally married to through the court and have a marriage certificate for that's signed off and recognized. If you don't have a legal spouse, they will look at adult children, oldest to youngest, and then they move on to parents. And if none of those options are available, then they will look at domestic partners, siblings, or close friends, or anyone that kind of comes forward and says they're involved in your life, and they kind of rule out all those other categories. So if this is not the hierarchy or order you want to have happen, it's important for you to choose a person to be your healthcare agent. Completing advanced directives is very easy to do, especially here at Ironwood. Our social workers are happy to meet with you and educate you and go through each of the packets and forms and kind of talk about the different topics and provide that education to you. And we're also able to sign off as a legal witness, help get those papers copied and sent off and registered. So the first thing you can do is contact your Ironwood social worker. We'll help you fill out the forms that apply to you. We'll make sure that you're able to express your wishes for end-of-life medical care. And then we'll sign off on those documents as a legal witness, provide the copies to you and your health agent. Then we ask that you keep the original forms just in case. We do scan a copy into your patient file here if you're the patient at Ironwood. And then we help you register your documents with the Secretary of State. Registering your documents with the Secretary of State is free to do, and it's very important. They've created this electronic portal with the Secretary of State where all these documents go, and you can keep them there, you can change them, you can add to them, you can remove them, you can do anything. It's not a permanent fixture in the portal, but once it's there, any doctor that's treating you can access those documents and see the decisions you made. It prevents in the past when you used to have to walk around and provide a handwritten copy to all of your doctors or carry it with you so that if you ended up in the hospital or emergency room, they knew your directives. This also prevents you from having to redo all of those documents multiple times. So once they're in there, they're there until you move them out. It's very easy to do this. You make a copy of your completed documents. There's a registration agreement that's a very simple 1 page. And then there's a signature page that you sign off on, and you mail the documents to the Arizona Secretary of State in their Advanced Directives department. If you complete this paperwork with your social worker, they can assist in this process of getting the documents registered. There is no cost for this registration. Once the Secretary of State receives the Advanced Directives packet, they send back a piece of paper that just kind of confirms this is what you're doing. They ask you to sign off on it to verify that this is what you want and you want them registered. And then they mail you what looks like a little insurance card or ID card for you to put in your wallet. And it has a number of your ID so that you can show your doctors exactly where your documents are registered and how they can look it up and find out that information so that, again, you don't have to keep providing copies everywhere you go. The first section of the Advanced Directives packet is a lot of instructions, a lot of frequently asked questions, some definitions. There's a lot of terms in the packet you may not understand. We're here to help explain those to you, but there's also a good reference guide at the beginning of the packet. And then the first section is the healthcare power of attorney. This is where you, the principal, selects your healthcare agent, the person who will make your decisions should you become unable to do so. It also gives you an option to choose a secondary agent should the first one be with you at the time and not available or doesn't answer their phone. And so there's a backup just in case. They do go with your primary choice, but there is the opportunity to list a backup. There's a lot of topics in the healthcare power of attorney that can seem a little uncomfortable to talk about. Life care planning is important to do, and it's important to make sure your wishes are expressed and that you get exactly what you want when you're in a situation where you can't make those decisions for yourself. But a lot of people can kind of be uncomfortable, but that's okay. We're here to help you and make sure that you're educated on each of those sections. This could include the voluntary autopsy. In the state of Arizona, they only do an autopsy if the death is related to homicide or suicide. Other than that, the option to do an autopsy is voluntary. So you can say, yes, I want one, no, I don't, or I'll let my agent make that decision. Then it goes in to talk about organ and tissue donation. There's 2 purposes for this. One is transplant. That means you're going to give your organs, skin, tissues to another person so that they can have those once you pass. And then there's research purposes where medical students use them to learn how to do their job and their role, and they also use it for education and treatment advances. So you can choose if that's something that you're interested in there. Then it moves on to discuss funeral and burial choices. It'll ask you if you want to be buried or cremated, and if you have signed up with a company already, maybe you've prepaid for a cremation or you know where you're going to be buried, you can list all of that information in this portion of the packet. And then there's a waiver for HIPAA, for confidentiality. This allows your health agent to be able to access your records and your information in order to make the decisions that are best for your care. And the packet does give a lot of examples of what kind of decisions they may have to make, including ordering blood tests, getting you transferred to a hospital, performing some type of surgery, or prolonging life measures such as cardiac resuscitation or ventilation. So that waiver just protects them and allows them to access all your records so they can make the best decisions. The next section is a mental health care power of attorney. This allows you to select an agent to make mental health care decisions for you in case you become incapable of making those decisions for yourself. The healthcare agent for your mental health care power of attorney can be the same as your regular healthcare power of attorney, or it could be somebody different. It does not have to be the same person. This document allows you to choose mental health treatments you authorize and specifically those you do not authorize. It is revocable as long as you are cognitive and able to make decisions clearly. The next section is the living will. This is the specific document that discusses end-of-life care. It is only in place when you are in a terminal condition, persistent vegetative state, or an irreversible coma. This allows your agent to make medical decisions for you when you are unable to do so for yourself. It allows and discusses the level of intervention that you're comfortable with by medical professionals to treat you, care for you once a doctor has determined that your condition is irreversible or incurable. It goes through 5 different options regarding life-sustaining measures and life-prolonging measures. It starts with the least amount of intervention, which is comfort care, which means there's no CPR, there's no ventilation, they don't take you to a hospital, there's nothing done to sustain your life or prolong your life. They do make you very comfortable. It allows for pain management, pillows, blankets, for you to be around your family and your loved ones so you can pass naturally on your own. That's the lowest level, all the way up to the very last option, which says provide as much treatment, as much intervention as possible to sustain your life and prolong your life as long as possible. This could mean being put on a ventilator when you can't breathe on your own. It could mean giving you CPR should your heart stop and you need to be resuscitated, or if you need to receive food and fluids through IVs because you can't take those through your mouth. So it's a variety of choices and there's all kinds of levels in between, and that's why as social workers it's really important for us to sit down with you in person and kind of go through all the options and then help you decide which one is most comfortable for you and what is your preference. We don't make those decisions, you do, but we help explain your choices so that you can make the best decision possible. The last document you'll recognize because it's bright orange. It's actually legally required to be on orange paper. The reason they do this is because they ask individuals to put the pre-hospital medical care directive, also known as the DNR, on your refrigerator at your home. Firemen and EMT are trained that when they come in the home for a health issue to look on the fridge and see if there's a DNR. A DNR is a document that must be reviewed with and signed in the presence of a physician. Our physicians at Ironwood review these documents with patients all the time, but a lot more often the patient feels comfortable doing these DNR and this document with their primary care physician. It informs medical professionals that you do not want to be resuscitated in any way. So if you're having a heart attack and your heart needs to be restarted, they will not do this. There's no use of equipment, no drugs provided, no devices used to restart your heart or help you with breathing. The doctors will provide you comfort care and alleviate pain so that you can pass naturally on your own. And the document is signed by a legal witness or notary after your physician signs off on it. It's a very big decision and it's a lot of things to consider with a DNR, so that's why they require you to go over it with a doctor so that they can explain all the medical terms and what it means and the complications that arise sometimes with a DNR. So they help you through this process, they sign off on it, and then you put that document on your fridge. And that way, if someone were to come into your home, they can see that you have that document and that they can respect your wishes. Not everyone does a DNR. It's an individual choice, but it is available to you as well. We do provide patients with a copy of the DNR, and if they want to complete a full one, we can give you a copy on orange paper so that you can go over it with your physician. One of the things that's in the packet that's kind of nice for patients and families is there's a lot of community resources included in the advanced directives packet. This includes the Arizona State Bar that has a helpline for finding an attorney in your budget, in your neighborhood, or for estate and property. This document, the Advanced Directives Life Care Planning, only deals with medical issues. It doesn't deal with financial and property. So sometimes people take and do this all together with an attorney, or sometimes they seek an attorney to help them with estate planning as well. There's also the 24-hour Senior Helpline. This is connected to the Area Agency on Aging regional offices. These offices are designated to serve all of the counties in Maricopa. The phone number we have, 602-264-4357, is for the Maricopa County Area Agency on Aging. They have a massive amount of resources and supports. And again, they're available 24/7. You can call. If you do get their voicemail, you can leave a message and they will reach out to you. But they are able to help with housing issues if you're looking to find a new place to live, or maybe you need to transition from living on your own to assisted living. They have coordinators that can help you. They have different realtors that can help you get into maybe some of the private, independent, or semi-independent assisted living, nursing home communities, etc. in the area. But they also manage the Meals on Wheels, which is a program that comes up often when social workers are talking to family and they ask if they're going to qualify for Meals on Wheels. The Area Agency on Aging kind of starts that process and determines immediately if you're qualified for that program or not, and helps get you started with that application. And the last resource that was located in the packet that I have found to be very helpful is the Elder Law Hotline. This provides free legal advice, information, and referrals to any Arizona resident that's 60 years or older, or to family members who are calling on behalf of a senior. So this might be your power of attorney or your health care agent, and they're needing some assistance with legal advice for a situation you may be in. And so that's a good resource to have. All of these documents are located at the Arizona Secretary of State website. It's a pretty big packet. It prints out to 20+ pages, but social workers have plenty of these to share and give out. So the best thing to do is just contact your Ironwood social worker. You can call us directly. My name is Nicole and I cover the north and west side of town. But Jessica Wells is our other social worker and she's fabulous. She covers our East Valley offices, or you can always just reach out to our department. Sierra is always available to take calls for us when we're not available, and that direct number is 480-314-6660. You can also email us at socialwork@ironwoodcrc.com. And I think at this time, I can open it up to see if anyone has any questions about advanced directives, or if there's anything else you'd like covered.
Great, thank you so much, Nicole. We appreciate all that information. It's very helpful information for all of our patients and their caregivers. So we do have a few questions here. We actually have quite a bit. So our first question here is the advanced directive I completed in Arizona valid in any other states?
That's a really good question, and people ask that a lot. We have a lot of snowbirds that travel to Arizona in the winter, but head other places in the summer, and just people in town visiting, or if they're going to go spend places or time vacation with family members. Every state is different in the reciprocity of advanced directives, which means do they accept other legal documents from other states? So it's an individual basis that you kind of have to reach out to where you're going to see if they'll accept your Arizona advanced directives. What I always tell patients is to take a copy with you and have it with you if you're going to travel. And that way you have something in writing that's signed off by a legal witness. and it kind of shows what your decisions are. If you're at a hospital and they need you to redo the documents because they don't recognize the Arizona ones, then at least they have all of your decisions already made and they can help you just replicate those on their paperwork from that state.
Great, good information. Next, is this different than in a state directive, it looks like?
Okay.
A state, sorry.
Like a state planning?
Correct.
Okay. Yeah, so advanced directives, life care planning, kind of what we just went through, again, is related specifically to your health care decisions and medical decisions. If you were in a situation where you became unable to do so. Your estate planning can involve your finances. So if you have bank accounts or a 401k or life insurance policies, a home that you own, property, so anything property financial, that estate is where you decide who gets what and what happens to your property should you pass away. And sometimes they have an executor that you choose that kind of makes sure all your decisions regarding your financial stuff and your property is delegated the way you wanted them to be, but it doesn't necessarily involve your medical care. Sometimes individuals will do all of it together with an attorney, and sometimes they do it separately.
Great, good to know. Thank you. Next is, can my Ironwood physician or oncologist sign my do not resuscitate form?
Absolutely. Any physician in Arizona that's licensed can sign off on a DNR. And I think it's a very good conversation to have with them just because of the nature of what that document means, and they are providing medical care for you. It's an individual decision of which doctor you use. So it could be your oncologist, it could be your radiation oncologist, or it could be your primary care physician.
Okay. Should I give copies to all of my doctors?
You can make copies and provide them to your doctors. Most physicians and medical practices will scan a copy of that document into your chart as a patient. So that way they are well aware of what your decisions are. So that if there was an accident at the office or something were to happen, they know what you want and who to contact to help get the care that you need, the treatment you need, and make sure your wishes are granted. Once you register your documents with the state of Arizona, you can just provide a copy of your registration card and tell them that your information is on file with the Secretary of State. Any provider in Arizona can log into that portal and access this actual documents.
All right, that's good to know. And it looks like our last question here is, if I change my mind about who I would like to be my healthcare agent, do I have to resubmit it to the state?
Very good question. Yes, you do. Things happen. Sometimes we choose a spouse and that spouse passes away before we do. Sometimes we choose an individual and they change their mind and say, I don't want to be responsible for that. Or sometimes we choose an individual and they move out of state and you would feel more comfortable with somebody who's here in Arizona. So at any point you can change who your agent is or what your directives are. How you do that is refill out the information, the paperwork that you need to change that individual as your healthcare agent. And then you submit it with the registration agreement for the Secretary of State. There's an option on there that says, I'm replacing an existing directive with a new one. And it's free to do. And so you just sign off on the registration agreement, provide that new copy of the packet with the new information. And they send out a confirmation that says they've now changed your documents to reflect your current decision.
Great. This has all been great information. Thank you so much, Nicole, for joining us today for today's Lunch and Learn. We do have another Lunch and Learn next week, and it will be with Glendale Radiation Therapy Team, and it will be on Radiation 101, behind the scenes of radiation. For additional information, please check us out online and supportive care services. And if you need additional information, you can also contact us at wellness@ironwoodcrc.com. Thank you once again, Nicole. We appreciate you being with us today.
Thank you.